Hi, I'm Dr. Joe Niamtu, and I'm sitting in my recovery room, and this is where our patients recover after surgery. One of the most important things about cosmetic surgery is the care that the patients get and the care that the family delivers. To have an optimum recovery, it's very important to do the things that we tell you in the way that we tell you. So since there's so much going on before you leave the office and a lot of information that's been exchanged, we're going to go over this step by step in this video. Remember, you were given explicit instructions in your preoperative pack, so you can also pull those instructions out and read those, and we're going to show you how to take care of the average cosmetic facial surgery patient.
Now, if you've had facelift surgery, almost all of our patients are going to have these little vents that we place overnight. And what these do, they allow the healing fluid and some of the blood to escape so it doesn't get built up in your neck. And these will come out the next day. Now, what we have to do is to catch the drainage that comes out of here. And so when you wake up, you're going to have a bandage over this. And again, these will allow the fluids, the blood products, and some of the liquid anesthesia that is injected in the facelift to drain. So we're going to show you how to take care of these. So we have to absorb this drainage, and what we have is a wad of gauze, and this is held in place by an elastic dressing that goes around the neck. This is not tight, it's just enough to hold this gauze to catch this drainage overnight, and again, this will all come off the morning following your surgery. Now, what we do is we're going to give you gauze to take home with you, and these gauze are in squares. And let me zoom out here, and you can see the square. And now you're going to unravel these squares of gauze and make a little pile. Usually it takes about 3 or 4, maybe 5 of these, and this is going to be your replacement. So what you're going to do, and remember, the gauze that's under that netting sometimes gets quite bloody, but you also have to remember that what you see is not all blood. That's a mixture of fluids that the body makes while it's healing, and also a lot of that is local anesthesia from the procedure that was injected earlier. But these will get quite wet sometimes, so here's what you're going to do. You're going to gently lift up the elastic bandage. You're going to take out the blood-soaked gauze, and you see the catheters are still in place. And now you're going to take this new wad of gauze. You're going to put it just under the catheters a little bit. Really, all it has to do, although Jenny's wrapping them around right now, it really just has to be a ball of gauze that covers this area to prevent this from dripping down on the patient's body or the patient's clothes. Now, some patients will change this once a night. Some patients will change it every couple of hours. And again, it's perfectly normal, and the reason that these vents are in place is to drain this fluid that would otherwise be caught up in the neck like a water balloon and delay your healing. If in the event that one of these drains would come out inadvertently, if it would pull out or fall out, it's nothing to worry about. You don't need to call us. The fluid will still drain through the tiny puncture site from the vent. Now, if you had a facelift or possibly some other types of surgery, you may have a elastic bandage on, and we call this a jaw bra. And what this does is help compress the facial tissues. It helps limit the swelling and helps make the patient a little bit more comfortable. Now, sometimes these are tight and they may be a little bothersome to the patient, and they're very easy to release. There's a little Velcro tab on the top, and you simply open this up, and you can release this and leave it down for 10 minutes or so if the patient is uncomfortable, and then you can just simply put the Velcro back. You can also see that she has some gauze sticking out the back of her ear. Let's take that out. Just take the gauze, no, just leave the dressing on and take the gauze out. Now let's stick the gauze back in from the front just so patients can see what we have going on there. And this gauze, again, is just kind of sits in there passively, and what this does is help drain any blood so it doesn't drip down on the patient, and also serves to compress that area. If for any reason the patient cannot tolerate the jaw bra it can be safely removed. However, we think that it's good to leave it on 24 hours, and we will take it off the next morning. In rare circumstances, we may give you another jaw bra to wear for several days if we feel that that is warranted. So we've kind of explained our post-op procedures for the most common surgeries that we do. Remember, you also received written instructions in your preoperative work, and you can refer to those or watch this video again. And if you have a problem and can't figure it out, you can call Dr. Niamtu or Jenny or our office. Thank you. This is Dr. Joe Niamtu, lovethatface.com.